So we're here at Westlake High School in Austin, Texas. We're putting on our annual community outreach event. We do this as part of our annual Congress. It's our opportunity as East members and Society of Trauma and Nursing members to give back to our community. We're doing 4 different things today. We're doing Stop the Bleed, we're doing distracted driving, we're teaching about firearm safety, and we're also talking to our students about careers in healthcare associated with trauma. As you know, trauma is the #1 cause of death in young people. And so we think it's really important to drive the message to them that they can really do things to make sure that they stay safe. This community outreach event represents East's mission because it really offers an opportunity for people who are young and developing in their professional careers to really find out how to contribute and to give back to the different places that they come from.
So as part of East's core mission and values, we want to promote young scientists, physicians, nurses, people that come from all areas of healthcare.
As a young trauma surgeon, we want to see our communities thrive and have the best injury prevention that's out there. And so I think our community outreach efforts at our Eastern Trauma Conference go a long way to help inspire us to go back to our own cities and do the same types of projects there.
This year especially, we're really trying to partner with our local resources. We're partnering with a great local organization for distracted driving, and we're also partnering with a great organization for firearm safety. We've also reached out to our local police departments and EMT partners as well to really help bring a sense of community to Westlake High School in this outreach event.
Teens in the Driver's Seat is a peer-to-peer outreach program focusing on traffic safety education. The reason we're doing this is because car crashes are the leading cause of death for youth starting at age 13 all the way through 25. So we're trying to get in touch with teens and do things that are fun and engaging for them and educating them on traffic safety issues such as speeding, impaired driving, not using their seatbelt, as well as distracted driving.
Some really important prevention themes that we try to stress to the young population is distracted driving. We have a really interactive program with them. It's an hour-long program where we have various interactive modules, some of them being distracted driver modules, where they get to experience what it's like texting and driving and the dangers of that.
Distracted driving allows students to learn about different ways of being distracted that they may not have thought of before, in addition to just texting, such as even eating food while driving, and learning real ways to understand that both through games where they address how their focus can be pulled in various different ways, as well as knowing what to do to help prevent that, such as various different activities, and really making the conscious effort and pledge and knowingly understanding what you're doing and how you can prevent it in the future. These are high school students that are really within the age group that is most affected by a potential injury or death from a car accident or a pedestrian accident, and so it's very important to engage them, sometimes even before they're getting in the driver's seat or when they're participating with their friends, so that they build these lifelong practices going forward.
Stop the Bleed is a national campaign that is out to teach people what they could do if they were ever unfortunately involved in any kind of traumatic incident where there was bleeding. A cut that occurs, or it could be secondary to a gunshot wound or a stab wound. It could be something that occurs in a motor vehicle crash or something you see in a school or in a business. It's skill sets that everyone should be able to learn and be able to help others and help themselves.
The Stop the Bleed portion of today teaches kids ways to stop life-threatening bleeding. #1, how to identify what is life-threatening bleeding, and then how to use simple, effective techniques such as tourniquet placements and wound packing techniques to stop that.
It's important to teach students about Stop the Bleed just as it's important to teach students about CPR. It's a true life-saving skill. It can literally have a critical effect on outcomes of people in situations with trauma where they may not otherwise survive.
And so this is something that's a national campaign that's being taught all around the country, and we're happy that we could bring it here to the students of Westlake to teach them about skill sets that will give them information, but also will teach them things that they could possibly help themselves or somebody in the future.
The firearm safety portion of this program is focusing on both firearm safety, how to act around guns if you find them or you encounter them in your life. It's something that kids aren't really faced with a lot or given instruction on a lot. And the other portion is talking about suicide. Suicide is really rising as an issue within the teenage population. And so we're touching on the specific things that may help them as they sort of progress through their high school careers.
We know that guns play a huge part in the death toll when it comes to suicide. And so talking to the kids about suicide and in correlation with gun safety, it's very relevant because we've actually had kids come to us after and talk about friends or talk about and ask what to do. And so it's just great to be able to get that response back from the students.
As an organization, EAST is really focused on a variety of different aspects, but one of the most important pieces is injury prevention. We've really engaged with the community in Austin to talk about injury prevention. And this is one of the most important aspects as it pertains to the purpose of the Eastern Association for the Surgery Trauma, where we are focused on exchanging ideas when it comes to injury control.
As a trauma physician, I see injuries such as texting and driving injuries every day, and I see young people come into our trauma facility every day, and I see people after the injury has happened. And this event really gives us a way to promote injury prevention and to stop these events from happening. So I don't see these people in my trauma bay when they come in.
The Careers in Healthcare program allows an opportunity for our students to ask how they can also get involved in the future. As young people, they're really interested in how their career paths may take them, what ways they could get into different career paths. I really find that students are very engaged when they come to these programs. It offers us a chance to give them a glimpse, not only in becoming a doctor or a nurse, but also an injury prevention specialist, a pharmacist, an EMS provider. So these are all things that we're able to cover in this program.
We are trying to introduce students to future career paths and questions about medicine, but also teaching them skills that they can use in everyday life.
It's important to teach students about the different careers in trauma so that they understand there's a wide variety of options. Just as there are different learning styles, there are also different career styles, and I think everything is available and on the table for a child who is still going through high school.
The thing that impacted me the most today was probably getting to hear the medics and trauma surgeons and other nurses and get to speak about their careers, because this would help me with potentially getting a career in the future and just something that I could do. After today, I'll definitely be more aware of whether it be distracted driving or guns or bleeding. I'll be more aware of my surroundings and definitely be able to do more to help others. And I know that I can keep myself safe by going and trying to prevent activities like distracted driving and gun-related injuries, and just kind of being knowledgeable about those and just helping people prevent those type of things.
I learned more safety precautions that I could be taking, and there's so many things that I can do in a traumatic situation to help a civilian, even though I'm not a certified physician. I think what impacted me most today was working on gun violence and gun safety, because I learned things that I never even would have thought to consider. I would tell others just to get educated, go and learn things so they can educate everyone, so everyone can practice a safer environment.
I'm personally involved in this program. I think similarly to a lot of other trauma surgeons, we know that there's various different ways to improve our outcomes and improve and prevent death and morbidity and mortality from trauma, but the number one way to do that is to prevent the injury in the first place. And that's what's so important to us, is knowing that the general populace, and especially young people growing up and coming forward, are instilling these practices within themselves.